There are several ways of performing DMEK surgery, but these can be broadly defined into two groups. One is what we consider to be an endothelial out procedure. An alternative approach is what we call the endothelial in technique. In order to pull in the graft inside the eye requires forceps in the endothelium in technique. We have designed these new 27 gauge DMEK forceps that are precisionally made to ensure that the DMEK graft is not damaged during insertion. The jaws are 27 gauge, so they will fit through a incision size smaller than 0.1 millimeters, and the high power picture of the jaws showing them to be non-applicating, and there's no serration on the jaw, so when the DMEK graft is being pulled in, you will see that there is no damage to the tissue itself, so there's less risk of getting a tear in the tissue. As I am holding onto the graft and pulling it inside the eye, you'll see that the graft will spontaneously open with the endothelium position facing down in the correct orientation. This can be aided by a little bit of tapping on the surface of the eye, and then a gas bubble using a 1 ml syringe is placed into position itself. Forceps can grasp the tissue well and hold it into position. In over 150 cases that I have done with this pair of forceps, we've had no cases of where the tissue has been torn with these forceps. Another key advantage is that the incision size is quite small, less than 0.1 millimeter, so there's no need to suture your incision once the graft is in position. We use these forceps with a 23 gauge double port AC maintainer, and this allows you to maintain the anterior chamber well without having any jets of fluid moving the DMEK graft inside the eye. 27 gauge forceps allows you to have fine control of the DMEK tissue, so you know that there's minimal displacement of the graft, and then it requires less manipulation of the graft tissue, which we know is associated with endothelial cell loss once the graft has been pulled in to the eye. 27 gauge forceps comes in two curvature sizes, one is standard and one is severely more curved. Typically I will use a severely more curved for eyes that are more deep set.